Yes.
And good morning to our own Pledgemakers and new Pledgemakers. All of you have joined us on stage.
Why did you come closely?
Please join us on stage for the photograph.
Founding principle has been that NCDs are not inevitable, they are preventable. In response to this urgent need, Arogya World, Rotary and BPAC launched the Arogya City movement. Built on collaboration, it unites corporations, NGOs, schools and governments to improve health outcomes in Bengaluru. In just 2 years, Arogya City has reached over 2.1 million people directly and created nearly 98 lakh online impressions. From screening to lakh 75,000 individuals for NCDs to engaging 20,000 youth in health awareness programs, the impact is undeniable. We thank Satwa for doing a pro bono process assurance of the Arogya City program. Let's hear from Bengaluru's health champions.
आरोग्य सिटी मूवमेंट में ये हिस्सा लिया क्योंकि मैं इनके बारे में जानना चाहती थी। मैं शपथ लेती हूँ कि शुगर का इस्तेमाल कम करूँगी, चिप्स और चॉकलेट को मना करूँगी। हम घर में योगा क्लासेस टीवी से देखकर प्रैक्टिस कर रहे हैं। हमारे पेरेंट्स हमको चिप्स और चॉकलेट की बजाय हमको फ्रूट कोकोनट वाटर ला रहे हैं। थैंक यू।
Wonderful team of people here. We've all come together for a cause. What I've understood when we started this program was collaboration has to be the cornerstone for transformation. One of the things that we've done is that everyone have come together is not just individuals but organizations, right? We have colleges, we have corporates, we have government entities as well. We've all come together. And one of the best things that happened to all of us is how can we maximize the resources we have. So when one of the Pledgemakers was doing a screening, there was another Pledgemaker who joined. When Rotary was doing it, AI Health joined. When MLAC was doing it, Aditya Birla joined. So many of those have come together and we've made sure that we've made much progress. We thought we will reach 500,000 people, but we reached more than 1 million in the last 2 years. So all of us have put in effort, and mostly the Pledgemakers. They are the heroes because it is voluntary, as Nalini said, and people have the heart to do it. So we will look at the video of all the Pledgemakers that they've done their work and celebrate their success. Thank you.
Summit 2024. On the dais we have Her Excellency Shri Pramoda Ji, and of course the well-known Dr. Sudarshan Ballal, and Mr. Jairaj, person who has given distinguished service to Karnataka as a bureaucrat and now continues to do so in various other capacities. Srimati Nalini, who I've just heard is the driving force behind all this, and Srimati Revati Ashok from BPAC, all the members of the Rotary, and all the other distinguished people who are participating in this program, and all friends. So it's as a health minister, I must say that this is something that is really, let me use the other mic. So, first of all, I want to congratulate the Arogya City, the people who are part of this Arogya City Bengaluru, all the Pledgemakers and all the supporters for having come together and created this platform where various people can contribute and work together and create a sizable impact on the way people are living and the health conditions, and to try and see that how we can alleviate health problems that people are facing. So I think as a minister, I would like to congratulate them for having taken up this initiative and being able to implement in such a successful manner. I think that is the key. A lot of ideas are always thought about, but ultimately when it gets implemented, the impact on the ground becomes, not as we foresee. But here, I was just going through when I was walking down that passage, and I was looking at all the things that they've done, and I think it is wonderful that they've been able to reach thousands and thousands, in fact lakhs of people in Bengaluru, and being able to make a difference. And this is really a work, I think, which is highly commendable. Like what was said earlier, there are two aspects to health. One is when you fall ill and then you need to get treated, you go to either the government hospital, the private hospital, nursing homes, clinics, and get yourself checked and start your treatment. That's when we go to Dr. Sudarshan, Ballal, to Manipal, because we have fallen ill and we need to get treated. And that is something which is very, very important, no doubt about it. Every country, every state, every city needs good medical facilities, good doctors, good paramedics, and good ambulance services. All that is of great essential. It's an essential requirement. And there are many people in this field. There is the huge private sector, there is the government sector, and there are individual doctors with their own private clinics and small nursing homes all operating. So there's a huge supply for the demand that people who are falling sick are creating. So that is one thing where we can say that to a large extent people do get services. There's no lack of service availability. But I think on the other side, when we talk about preventive health, and when we talk about how we can stop people from getting sick, or to be able to control the spread of disease, or to be able to improve people's lifestyle, there is no incentive for a private person to come and work. Because it's not that there is any money to be made or profits to be made. It is a service-oriented field. And in this space, the biggest responsibility is for the government. I think government should look at the preventive part in a much more bigger manner than what we are looking at today, and give our greater focus on public health, to see that how we can improve public health. And that has got various components. Revati Ashok was saying, it's a question of lifestyle, clean water, clean air, better, planned cities, all that things contribute to health of an individual. And the kind of food we eat, the quality of food, all those things play a big role. So government's role is very, very crucial here. And along with government, I think, to actually make it, really successful on the ground, it requires an enlightened citizenry, an enlightened, people who are coming together to doing work for the good of society, and NGOs and institutions like Rotary and BPAC and so many of the names that we see over here who are contributing. So this is a very, very crucial area for us. And I think the Arogya City concept is focusing on this aspect, NCDs, because rightly said, non-communicable is becoming more than communicable. In the earlier days, it was communicable diseases which was affecting people's lives due to poor water, poor sanitation, lack of nutrition, so many things. And of course, a spread of diseases, mosquitoes, and all those things used to cause. And so many diseases like cholera and malaria and typhoid, and these were the large, they were the main killers, we can say, which used to affect our populations. But today it's different, because our country has progressed. Better water, cleaner water, cleaner hygiene, better hygienic conditions, and vaccination programs, and being able to control diseases, and all the epidemiology, all those things have come together. So the ratio of the communicable diseases have come down, and NCD is shooting up. So as we progress, we are becoming lazier, we are eating more foods that we should not be eating. We are, leading a lifestyle which is affecting our physical and mental health. We are getting obsessed. The newer technologies has transformed society, but at the same time, it is also changing society in some ways for the good, in some ways for the bad. And we need to be aware of this. We need to be aware of how this is affecting us. Because we are seeing people at younger ages getting diabetes, getting hypertension, having mental health issues, having depressions, feeling lonely, and all these things are contributing. So for that, it is not just that the government can come out with some program and announce it and we can implement it and sort it out. It requires, I think, a coordinated effort, an effort which involves society, organizations, and of course the public sector. And I think Arogya City has taken the lead in that and is creating a model which is not just for Karnataka but for the entire country. I think this model, if it works in Bengaluru well, and it's on its way now, if it is taken up to the next level, this can become a model for the whole country. How we can make people living in cities to be healthy and to be able to lead a healthy life. We are seeing in Delhi what's happening. The pollution and all that. That's all how everything is getting contributed to poor health. So Bengaluru is, I think we are at the stage now where we can still act and do things and prevent things from getting worse and prevent, the onset of further problems and control whatever is going on right now. So definitely I would really would like to say that the government of Karnataka and my department, we can really sit together and work on this, including BBMP, to take this forward to reach the entire population of Bengaluru. How do we make it? Because for government, as Mr. Jairaj knows, we need everything to be at scale. I cannot do a program in one taluka and one district and say I'm happy. I want it to reach every person in the state and to reach every person who needs it. And government has to work at that level. So I would like to just say a few more things and close my speech because many other people are going to speak here. We have launched a very ambitious program called Gruha Arogya. And in that program, that is already launched in Kolar, and from Jan 1st it will be launched across the state, where we will be screening the entire population 30 plus of the state. And we'll be going to their houses, checking for whether they have hypertension, whether they have diabetes. And if they are shown to be diabetic or hypertensive, we will be ensuring them door delivery of drugs to them, per month. Every month they will get the medicines that they are supposed to take. Because a lot of times we diagnose them and we leave them. They don't bother to take medicines. And even if they take, they will take and they will stop after some time. So we want to control diabetes and hypertension. And we will also be screening them for mental health. And we will also be screening them for some of the cancers like breast cancer, oral cancer, cervical cancer at a rudimentary level, and trying to figure out, whether they have any symptoms. So this is going to be done for the entire population above 30. And I think it's a very ambitious program. And it's a program which is, once if we diagnose someone, we will take care of the person till the end. The drugs that we give to that person, we will continually give it to that person till the end. So in Bangalore also we need to do this. So I think when we do it in Bangalore, I think we should tie up and see how we can link up this program and use your associations, and we can have people who can support us, sponsor this program or be a part of this program, because it's a very expensive affair. But we are going ahead with it. But if more people come together and support, I think it will become even more successful. And I think this Graha Arogya that we are launching should become part of Arogya City program also. I'd like to invite you for that. So, saying these few words, I think, I'm very happy that Arogya City, such good people are part of it. And I'm sure that it is going to be very successful. And let us take this so that we can really create, like I said earlier, a model which can be replicated across the country. I think everything that we do should be able to survive the test of time and should be able to be replicable. I think that is a successful model. That's how I think, how anything survives. So it should outlast. It should not be that we do something, runs for a few years, 3 years, then shuts down. It should become a model which can work and should become sustainable. And I want Arogya City to be that model, and I am willing to give whatever support from the government to make it workable. So thank you very much.
Good afternoon to all of you. Hon'ble Minister, Dinesh, Jairaj, because I've known Jairaj for many years. Dr. Ballal, Dr. Ballal, Saligram, Manipal.
Excuse me.
All the invitees and volunteers of the city to support the Arogya City movement. I'm very happy to be here this afternoon, to be part of this Arogya Summit 2024. It focuses on health and wellness. We've heard about health and wellness of individuals, but first I'm hearing about health and wellness of the city. So I congratulate the spirit behind this summit, and Saligram, all the participants, and people involved in this. I also congratulate the service-oriented organizations, corporates, volunteers, and collectively who are involved and who contributed to this summit for the commendable work which has made the city. I think I just heard earlier that they started with a very small number and then now they've reached 5 million, if I'm correct, 5 million people, and then they helped us reach that, and I congratulate Archana. I think you are the one who mentioned that about.
Yes, 1 million. Yes.
Yeah, so congratulate you on that. For me, health is, I'm not health free. Education mentioned, but I do take health very seriously. I believe that health is one of those very special gifts one can have to maintain good health. Of course, as we all know, we have to follow balanced diet, eat in moderation, eat anything but eat in moderation, everything in excess is bad. From there we know. But I, for one, believe that health and happiness are two important aspects of life which cannot be taken for granted. Collective. And as an individual, I encourage every one of you to take steps to preserve your own health and take charge of your own health. I, as an individual, strongly believe that each of us should take personal responsibility to stay healthy and active in this fast disappearing joint family values and support system. Arogya World Summit will be meaningful if all of us took personal responsibility to maintain good health, to lead a healthy and joyful life. On this note, I conclude, and I wish to thank you all, the organizers, for inviting me to this Arogya Summit. And I extend my best wishes to the organizers, service-oriented, like Rotary, and I don't know which are the other organizations for supporting you, collaborators, volunteers, and to achieve greater success in reaching out to the rural population as well as the urban population in the endeavor towards creating healthier Bangalore city. And I also want to say that I wish an extension of this model of Arogya Summit 2024 could become part of, as the Hon'ble Minister suggested, it can start across Karnataka. I'll be very happy to support if it can be extended to myself. Anything I can do, it will be my pleasure to support a similar model in myself. Thank you all.
To be with all of you, and Nalini, thank you very much for inviting me back to partner with you. I'm myself personally a health freak,
So it's a matter of great privilege for me to be associated and my various organizations to be associated with this program. I think the way we have been able to mobilize community is phenomenal. The kinds of projects a lot of you would have seen along the way when you walked in, you would have seen what kind of pledges have been made. Just to give you a brief, BPAC is a community organization. We work on several issues. During COVID, we were one of the most active people that we worked with the government to take last mile connectivity of all the provisions and various things. We were literally on hotline with all the officers. So I think we have tremendous reach. We have a number of leaders, trained leaders in civic activities, and we are able to take a lot of these activities to the ground. We have partnered with Biocon, we have partnered with many organizations for their screenings and for Paurakarmikas who are most at risk. So we did it across several constituencies for Paurakarmikas, cancer screening, and then taking it to the logical conclusion of handing it over to the BBMP and then telling them exactly who are all at risk and then connecting them with other people so that they can look forward to onward treatment. So I think we do a lot of work in terms of community outreach, and I'm so happy that today one of our event partners, Mount Carmel College, also of which I am an alumni, and several members here have relatives who are alumnus of this esteemed institution, has also partnered to be a Pledgemaker. So I think we want young people to be more involved in issues of health and issues of preventive diseases. One of the big things, I don't know how many of you all know, that globally 38 million deaths, 68% of the deaths are through non-communicable diseases. And India, it is 60% of the deaths are non-communicable diseases, largely diabetes, cancer, obesity, these kinds of things. And therefore, all of us, a lot of these are lifestyle diseases. So we are doing several programs to ensure that we are plastic free, garbage free, several things that impact the environment. I don't want to take much more of your time, but I think this is absolutely fantastic to have so many young people participating in this summit. Thank you.
It is a project to take care of health emergencies. Of course, the state government health department also takes care of the health emergencies, but to support the state government, we have launched this project ASRE, wherein any health emergencies anywhere in Bangalore, if an ambulance is required, an ambulance will reach the place. We have prescribed a number. This number I will circulate with all of you. Anybody in Bangalore can call up this number to seek assistance of an ambulance or a doctor on call. This is a service given free of cost by Rotary throughout Bangalore. I will share this. In fact, it was inaugurated by our Health Minister just 1 and a half months back. So I request the authorities to share this message of Project ASRE. Number one. Number two, you are all aware about the cervical cancer which has spread, which is being spread so fast in India. In fact, for this, we have already given vaccination to around 350 adolescent girls in the age of 9 to 14 years. So we want to continue that project. We take a pledge here to vaccinate at least 10,000 girls before the July of 2025. These are the two pledges that we would make as the district governor of Rotary District 192. I request Aneja, who made a pledge last year of 2 lakhs tests, to take up the third matter.
Where we can probably have more logistic control, have more data, we can collect data on app, and if everything goes well, suddenly we probably, we will know in next 1 month or 2 months, we will go to 500,000 screening in a very, very short period. And I'm so, see, the best part today is, I can tell you, when you have people like our health minister here, the whole setup is so receptive to the new ideas. When people talk of red tapeism, I do not see when it comes to the public health, there is any kind of red tapeism here. People are so open to ideas, working with us. I had spoken to our health minister on some cancer screening project. He immediately offered, please come and do it, because something which we want to launch in Tumkur in one district as a test case. Probably the person who has designed it is working very well in Gujarat. I think it will become a model for cancer screening. Now why I'm talking is our scope with the Arogya City project is only on diabetes. But we have a wide spectrum of projects in Rotary which cover from maternal and child health, disease prevention and treatment. We have literacy and education, water and sanitation, taking care of economies, peace building, and environment now, which is the 7th area of focus. So it's large. Here, the scope for this screening is very small, but it's a big thing for us, because typically we spend, sir, it is not a mean fee, in our 2 districts combined. In 1 year, we spend almost about 150 crores of rupees.
It's a matter of great pleasure for me that Bangalore is the first city to be declared as a healthy city under the Arogya World Movement. So join me in giving Bangalore a big hand. Two years ago, when we began this mammoth enterprise, I was a little skeptical about whether we can achieve all these targets. But my skepticism has been belied because of 4 reasons that stand out for Bangalore. One is that Bangalore has enormous social capital, that is coming together of people for causes larger than themselves, like BPAC, Rotary and others. The second, as you saw in the quick progress report that came out, was the widespread participation from all quarters, not only corporates, but also colleges, educational institutions and NGOs, which signed on as Pledgemakers. The third is the great collaboration that existed, which made it possible for this program to be implemented, especially from the government of Karnataka, from all the public sector institutions and others. And the fourth is this emphasis today in Bangalore that well-being is very important and that prevention is better than cure. So these 4 factors have got together to create a success in Bangalore. But ladies and gentlemen, there's one powerful force, a 360-degree force that has created the success that Arogya City is. And that is Nalini Saligram. You have to only interact with Nalini to understand what her energy levels are and how much they exceed ordinary human standards. That is Nalini Saligram, and I'd like to acknowledge Nalini, your sterling contribution to Bangalore. You are a Bangalorean at heart, although you are a resident of some other place, but all the same, we acknowledge your work. I also would like to acknowledge the great work and contribution of BPAC, led by Revati Ashok, the various Pledgemakers that we will be meeting, Rotary, the governor and the ex-governor, past district governor, and in particular today, ladies and gentlemen, we must acknowledge the support we have received from the Mount Carmel College, Sister Albino and Sister George, Madam Principal, who have helped us create this excellent audience. As you know, the outcomes in the program that we have created focuses on blood pressure, diabetes, heart diseases and so on. And today we mark a 2-year completion and the next batch of Pledgemakers take over. Health being and in medicine and healthcare, He is celebrated for his exceptional contributions to nephrology and public health. He is the chairman of the Manipal Hospitals, Manipal Health Enterprises Limited, an alumnus of Kasturba Medical College, Manipal. He is triple board certified in internal medicine, nephrology and critical care. His career spans roles as professor at St. Louis University and chairman of the Manipal Hospitals. He has been instrumental in advancing medical education and patient care in Karnataka, performing the state's first cadaver kidney transplant and establishing the postgraduate training program in nephrology. His social initiative through the Belanje Sanjeeva Hegde Trust include free dialysis, pediatric kidney transplants, and health insurance for undeserved communities. He is recognized with various awards like the B.C. Roy Award, Times Lifetime Achievement Award. Dr. Ballal's leadership extended to critical efforts during the COVID-19 pandemic, setting a benchmark in healthcare and innovation. You might have also read his many columns in which he tries to educate the general public about various aspects of healthcare and how to lead a better life focused on well-being. Dr. Ballal, it's a privilege to have you here, sir. Welcome.
Spread over Bengaluru to cover their blood pressure, blood sugar and BMI. You know, I must thank Hon'ble Minister Gundu, you remember, end of June 23, you know, this partnership, we want to extend it over. Everybody knows that the problem exists. But Rotarians are known as people of action. So if you tell a person that you have diabetes and do nothing about it, what is the fun? So we want to take it to the logical conclusion. End of June, that was the time when the elections were going on, the partnership was delayed, and then we thought that we should carry this partnership to the PHC, probably cater to the segment which normally is not do not have access to good health care.